The rest of the United States is being overrun by Omicron. According to the Wall Street Journal, the 7-day average of newly reported COVID-19 infections is about to triple the pre-Omicron record set last year. That was when the U.S. was reporting 250,000 cases a day. Here in Idaho, we're spiking too, or at least starting to. We've more than doubled our 14-day average from less than 400 a day to more than 800. We've gone from a statewide positivity rate of 5.5% 3 weeks ago to 17.1%. And COVID cases are one thing, positive cases. It's when those translate into hospitalizations is what worries and what will burden our healthcare systems, a trend we are already seeing. Let's take St. Alphonsus Regional Medical Center. Positivity rate there, 28.6. It was 8% a week ago. That's just testing within their health system. They tell us last Thursday they had just 23 COVID patients in their entire health system. By Friday, it had more than doubled. Today, it is up to 79 COVID patients out of the 400 in the hospital across all of their facilities. 28% of the patients in the intensive care unit are COVID patients. It was 20% last week. The worry is it will get worse. Nearly 4 months ago, we were allowed inside the ICU at St. Alphonsus, at the beginning of when hospitals around the state were operating under crisis standards of care. Crisis standards ended for most of Idaho right around Thanksgiving. So we wanted to check back in to see how things are going now and how they see this next wave hitting them. It's been a little more than 3 months.
This is the main intensive care unit.
Since we last spoke with Dr. Megan McInerney.
We've got 22 beds in this unit. The majority of the patients in this unit are COVID positive.
20 of them, she told us then, were on a ventilator, breathing only with the help of a machine.
And in the unit next door is a 10-bed ICU, and every single patient in that ICU is COVID positive right now.
Safe to say, the situation at St. Alphonsus Regional Medical Center
We have 4 ICU doctors on today during the day. We would usually have 2.
has gotten a little bit better since then.
It's insane.
It is insane. A little bit. But is it as insane as it was the last time we spoke with you?
As far as in-house is concerned, no, not at all. It's different. So the numbers are increasing at a much more rapid rate in the community than anything we've ever seen. However, we here in Idaho are not yet seeing the really high rates of inpatients and ICU patients from this Omicron surge, but it's coming.
For example, the admission numbers at St. Al's for COVID patients have tripled in the last 4 days. Some even vaccinated, but often not boosted.
So yes, we are starting to see more vaccinated patients than we did previously, but it's still the majority are unvaccinated.
Which is what worries Dr. McInerney the most, with another cresting wave of COVID.
Our team is bracing for this surge, and that's going to be hard.
The last time we spoke with Dr. McInerney, we caught her on a tough day.
You did. It's not that the death doesn't affect us, right? We're not robots. We all tear up, go home and cry to our family members at various times.
It was September 23rd, 1 week after crisis standards of care was activated statewide. St. Al's third floor ICU was at capacity, almost all of them COVID patients. And they were in the middle of their third code blue of the morning. It wasn't easy to be positive. Do you see the light at the end of the tunnel at all?
No.
You don't?
No. And that's heartbreaking for me to have to say. I did when I got my vaccine in December of 2020. That was my light at the end of the tunnel initially. But now I don't know where the end is.
Has anything changed between when I asked you that question and today? Do you see a light at the end of the tunnel?
I think the light that I do start to get a glimmer of is this idea that maybe Omicron is the variant that is so infectious that it will hopefully start to get through everybody and bring us out of this pandemic, right? So that it becomes more of an endemic process instead of a pandemic like we're in currently. That is some hope.
Was there ever a breaking point for you during last fall? Was there a point where you thought, this is overwhelming, like too overwhelming?
Yes, in October. when we were in crisis standards of care. So probably around the time, a couple weeks after you and I talked last time, there were moments where I felt like you can't keep doing this.
At that time, they had increased their ICU capacity by 8 more beds, a sort of MASH-like unit 2 floors below. That room was filled with patients for more than 6 weeks. But Dr. McInerney says they just kept going. She calls it an honor to work alongside such dedicated people, from the physicians to the nurses, a team that came out of the darkness of that Delta surge, but not unscathed.
We all needed a bit of a break from the surge, from Delta, which was good. We got that break. But there's a little bit of PTSD, right? When we hear that a surge is coming, again, everybody's like, oh my gosh, not again. Do I have to deal with this again?
You mentioned the PTSD side of this. Is there a resentment, though, ever among healthcare workers when they keep seeing the same kind of thing happening? The cycle of unvaccinated people coming in and requiring so much attention and help. Is there and I don't know if resentment's the right word.
Yeah, I don't know that it is. I can't speak for others, right?
Okay.
I can only speak for myself. And I wouldn't use resentment. I would use resignation, right? There's this sense of we're going to just keep seeing people who are unvaccinated show up, take care of them like you would any other patient. But it's also frustrating to acknowledge that they might not have had to come into the hospital at all if they had been vaccinated. You know, there was a period of time where I personally, would feel angry about that, but you can't. It's like stages of grief, right? You can't stay in that phase of anger forever, otherwise you just can't move forward.
And sometimes it's hard to move forward without sometimes looking ahead. That maybe this next wave will be worse than the last one.
I think it is going to get bad. I really do. I think we're going to have a full hospital again. I think we're going to have a full ICU again.
Do you think your staff, this hospital, can do that again?
I don't think we can do it the same way we did during the Delta surge. I don't think that we will have the staffing capacity to increase our ICU beds and our just COVID ward beds by as huge a volume as we did during the Delta surge.
And that would make it worse.
Right, because we would have to potentially turn patients away, and we never want to do that.
The reason for those worries, Dr. McInerney says, St. Alphonsus Intensive Care Unit wouldn't be able to handle another surge like the last one. Staffing. The burnout rate with healthcare workers has been high over the past year and a half, and you can't just pull ICU doctors and nurses out of thin air. Plus, with this variant so contagious, it's running through the vaccinated staff as well, and they all have to take time off to recover. Dr. McInerney says the hardest part of being the ICU director is keeping that positive outlook. Before Christmas, she sent out an email asking staff to sign up for extra shifts, knowing this surge was coming. I asked Dr. McInerney where she anticipates things will stand 4 months from now. Kind of on that question we asked before, she doesn't know where that end is, and she told us she doesn't have any way of knowing. We could see another variant coming down the pike, but she hopes Omicron will be the one that pushes us out of a pandemic and into a seasonal endemic, as you heard her say. There's one thing she does know, however. There's a sign in the hallway of the employee entrance at St. Alphonsus that last September highlighted the 2,400 COVID patients St. Alphonsus sent home recovered. Because of continuing to show up, just doing their job and supporting each other every day, nearly 4 months later, that number is now more than 3,000. And they will keep doing that, keep adding to that number to the best of their ability, no matter what wave rolls into Idaho. Dr. McInerney stresses the one thing that will make their job easier: increasing COVID vaccinations.